Hello everybody. Today we will study the anatomical directional terms. We should remember anatomy is not a sign, rather it is a language. As we use words to understand a language, similarly we need to know about certain terminologies in order to understand the internal body anatomy. So different terms are used to describe the position of the anatomical structures, so their relationship with one another. These include anterior, we also use the term front or ventral. Posterior, we can also use the term back or dorsal. Superior, we can use the term cranial or rostral. Inferior, we can use the term caudal or lower. Then medial and lateral. Superficial, we can also use the term external. Deep, we can also use the term internal. Proximal, distal. Unilateral versus bilateral. Ipsilateral versus contralateral. So we will discuss them one by one. So what is midline? Midline is the imaginary vertical line which is passing right through the middle of the body in order to divide the two halves of the body, that is into right half and the left half. So what are medial and lateral terms used for? So considering the midline as the central reference point in the body, medial means anything, any structure which is facing towards the midline of the body, or you can say which is closer to the midline. Lateral means something which is away from the midline. So medial towards the midline, lateral away from the midline. For example, if you see in this image, you can see two blue balls. The one is very close to the midline. So this will be considered as medial as compared to this blue ball, which is away from the midline. Or in this image, you can also see this example that this is thigh and this is the inner aspect of the thigh. So it is close to the middle line. So this will be considered as medial, and the outer aspect of the thigh, which is away from the midline, that will be considered as lateral. Superior and inferior. Superior means something which is towards the head, means top. We can also use the term cranial. Cranial, why? Because the skull bone is also called cranium. So anything towards the head, you can use the word cranial for that. Inferior means something towards the feet. So you can also use the term caudal, which actually means tail. So anything towards the toe will be considered as inferior. In this example, this is head, which is superior to the shoulder, this shoulder joint. Or with respect to the heart, you can say the heart is inferior to the shoulder, or shoulder is superior to the heart. The terms anterior and posterior are used when you are discussing something which is facing towards the front of the body. We use the term anterior, and when something is at the back or facing towards the back of the body, we use the term posterior or dorsal. For example, here in this case, the front surface of the body, and this bone is sternal bone, also called the breastbone. So this is anterior to this bony structure, which is the vertebral column or spinal column. So we can say that sternum is anterior to the vertebral column. Here in this image, this is knee joint. So knee joint is anterior, while the elbow joint is considered to be as posterior. When can we use the terms superficial and deep? Superficial means any structure closer to the skin or body surface, while deep means any structure which is facing away from the skin or body surface. For example, the lips are superficial to the teeth, and skin is superficial to the muscles. Muscles are superficial to the sternum, bone, and so on. Like there are some vessels, veins, which are very close to the skin. We will use the word superficial veins, and the vessels and veins which are deep to the or away from the skin, we use the word deep. Once again, anything facing towards the skin, body surface will be considered as superior. Anything facing away from the skin or superficial body surface, away from the body surface, will be considered as deep. The terms proximal and distal are used regarding how close or far something or any structure is from the point of origin. For example, here this is shown the shoulder joint as the point of attachment or point of origin. So anything close to it will be considered as, or towards it will be considered as proximal, while anything away from the shoulder joint will be considered as distal. So if we will take the example of this upper arm and forearm, so this bone in the upper arm, which is humerus, and the bones in the forearm, which are radius and ulna. So we can say that humerus is proximal to the radius and ulna, or you can say the radius and ulna are distal to the humerus bone. Like in fingers, the bones in the fingers are called phalanges. So there are 3 phalanges, except the thumb, which has got only 2 phalanges. So considering these 3 bones, which are called phalanges, the starting bone from the palm, metacarpal, will be called as proximal, because this is very near to the joint, and the last one will be called as proximal, and the middle one will be called as middle. So the phalange, which is close to the origin or attachment, is proximal phalanges, and the last one, which is away from the joint, is distal phalanges. Once again, showing the shoulder joint as the point of attachment or origin, we can say that elbow joint is distal to the shoulder joint, or it is proximal to this wrist joint. These are large intestinal loops. This is the point of origin, which is called ascending colon, then transverse colon, and finally distal descending colons. Unilateral versus bilateral is used when unilateral means on one side of the body, while the term bilateral means on both sides of the body, that is on the right side and on the left side. This image is showing blue color on one side of the body. This is unilateral. This is showing both the lower limbs as blue in color, so we'll use the term bilateral. So in this image, in the first image, there is diagrammatically shown as some inflammation going on in one joint. So this will be considered as unilateral because the other side of the joint is normal. So we will say unilateral inflammation of the knee joint. This is the image of the two lungs, right lung and left lung. Both lungs are showing tumors or masses. So we can use here the term bilateral. So if the things are present on the two sides of the body, we use the term bilateral. If it is present on one side of the body, we use the term unilateral. Ipsilateral versus contralateral. Ipsilateral means on the same side of the body. For example, the right arm and the right leg are on the same side of the body, so we will say ipsilateral. Right ear and right eye are also on the same side of the body, so we will use the term ipsilateral. Contralateral means one thing on one side and the other thing on the opposite side, so we can use there the term contralateral, like the left arm is contralateral to the right leg, or you can say the right arm is contralateral to the left arm. Body anatomical positions include supine and prone position. Supine means when the body person is lying with the front of the body up and the back of the body behind, and prone means the back of the body is facing up and the front of the body is facing down. Flexion and extension. Flexion means some bending of a limb or a joint. So any motion away from the flexion will be considered as extension. So flexion means bending and extension means movement away from the flexion. Abduction and adduction means motion away from the midline, and the adduction means the motion towards the midline. Body views, these can be viewed from different, body can be viewed from different angles. That is, we can see it from the front or anterior side, we can see it from the back and the dorsal side and the lateral.